Assalamu alaikum. My name is Dr. Mohammed Cyril Panawala, and today we are going to start a 10 talk series for the healthcare communication and skills. Why healthcare communication is important? Because it opens the door for patient and physician interaction, and physician and allied services interaction in the hospital and healthcare settings. So I welcome you in this series of talks, and this is the first talk of this kind in this series. So this first talk sets the foundation of understanding how communication works in the healthcare setting. It really means why it is both an art and science of communication, and how mastering it can dramatically improve the patient safety and satisfaction. So be with us throughout the video so that you can at least have an idea how the mechanism of communication in healthcare setting works, also how this communication can help improve the outcome for patient care. Now, why communication in healthcare setting is very important? Because 70% of the clinical errors are linked to the poor communication. It builds trust. When the communication is good, it reduces anxiety. It reduces the worriness among the patient, and the patient doctor relationship improves. It improves the outcomes of patient management, essential for teamwork and patient safety. Because if the communication is good between the healthcare allied workers, it increases the chances of developing a coordinated effort for the healthcare management and the patient management. So it is also helpful for the patient safety. Studies show that most adverse events in a hospital stem from breakdowns in communication between staff and with patients. When we communicate effectively, we prevent errors, enhance teamwork, and create an atmosphere of trust between the patient and the physician, and between the healthcare workers, between the healthcare providers, physicians, nurses, and other hospitality staffs. Now it is a two-dimensional thing, art and the science. The communication is having two components. What is art? The art is the tone with which we deliver our communication, our messages, our interaction, with the empathetic tone, with the active listening attitude, that we listen to the patient, that let the patient finish his or her story before we start interrupting them. There should be a human connection between the patient and the physician. Also, a human connection between different healthcare allied workers. And the science is the structure with which this message is delivered, and it with the clarity, and with the feedback loops, and with the communication tools like SBAR tools, which are commonly practiced during the rounds between the nurses, also with the physicians. So, art of communication is about emotional intelligence, how we connect and empathize with the patient and with our colleagues. And the science is about the systems, structured handovers, documentation, measurable outcomes. Both are equally vital. So, the tone of communication, empathetic attitude, and also how we deliver this message in a structured way with clarity and with the categorization according to the understanding of the patient is most important for the patient safety and outcome of the patient's management. Now we will enhance our discussion on the uh, principles of effective communication. What are the principles? The principle is that the message or the discussion between the patient and the physician or between the colleagues, whether they are physicians or nurses or allied healthcare workers, should be clear and simplified, not a complex words. And also there should be an active listening. Sometimes what happens when we are contacting with the patients or interviewing the patients, we want to interrupt the patient because we have a question in our mind so that it will lead to the diagnosis or the prognosis of the patient's management. But the problem is that while interrupting the patient will have a stream or a chain of ideas which will disappear, and it will affect the further history management. So, if we want to interrupt the patient, don't interrupt. We just have a pen and or a pencil or a paper, write our queries, write our questions on this while the patient is actively talking. We are actively listening. And we should not be timely bound attitude for taking the history or talking to the patient. We should not be in hurry. There should not be a time limit. Let the patient talk, let it ventilate their issues, physical or mental issues or psychiatric issues. Deal them with the respect, with an empathetic tone, and ignite a feedback loop. Feedback loop is what we repeat what the patient says so that we make them sure that we have understood their message. Or when we tell some message, when we tell our plan of management, tell the patient to repeat so that we make sure that the patient has understood our plan of management or the message is well taken. So it should be clear, simple messages, reduces the misunderstandings. Listening actively creates an empathy. The patient understands that he or she is the person who can take care of my issues without bothering me too much. Now we want to discuss few barriers of communication. There are some barriers which leads to the deficient or ineffective communication. The hierarchy issues, the chain of ladder between the commands. So the physician or the patient is afraid of opening up in front of the physician or the health staff. Also, there is stress of work. There is fatigue because of the overload. So, physician is not able to deliver whole of their whole of their capabilities or whole of their whole of their skills. So sometimes there's a language barrier when you are working in not in your native country or some other countries. There are cultural differences. This cultural differences stops the patient from telling the actual part of the story. Also, sometimes some doctors or nurses use medical jargons. So, the patient does not understand this. The message should be in simple words which the patient can understand. There should be no assumptions, no understanding automatically that, as I have said to the patient, he should have been understood. So, we often underestimate how hierarchy or fatigue can silence our voices. So, encourage open communication. No one should fear speaking up if the patient's safety is at risk. So, we should be very clear in our history and in informing the patient about the plan of management. Discuss briefly the simple models of healthcare communication. One of the method is very simple, like we tell deliver the message to the person who receives the message, and it do the feedback loop that you have said this, so he is confirming that this message is taken up. The other method is the S-bar tool. You know that it is a very famous tool about when the nurses or the doctors are giving the endorsement in the morning or during the change of the shift. They discuss the situation of the patient, the background of the patient's disease, his assessment, past and current assessment, and what are the recommendations. If the nurses are discussing, what are the recommendations given by the doctors, or the doctors are discussing, so what are the recommendations or advices they have given to the patient, or they ask for the a second opinion. So the other method is the closed loop communication in emergencies, where the colleagues understand each other's movement and there is a structured way of acting in this kind of scenarios. So healthcare communication should always include feedback, closed loop communication, repeating back orders, prevents errors, and helps solve the issues much faster than it is expected. So now we have discussed about the communication in healthcare and its importance. What is the impact it gives on the patient's experience? So the patient remembers how we speak more than what we said. So it is the tone, it is the clarity, simplicity which comes in play. It reduces the complaints, increases the trust between the patient and the physician, and it increases the compliance. Empathy improves healing and satisfaction, kind words, and active, attentive listening stay with the patients long after discharge. Empathy is not an extra skill, it is a mandatory skill for all the healthcare workers so that they can communicate very easily with their patients. So, at the end of this talk, we can summarize that communication is a professional skill. It is not just a soft skill. It blends the emotional intelligence with the structured models and methods. Patients practice this every day. Practice every day that we have to listen to the patients very carefully and clarify the delivery of the message and verify with the feedback loops. So, communication is central to the clinical excellence. In the next session, we'll discuss how we will build rapport among the patients and our colleagues and trust with the patients. An essential first step towards partnership is care. When we make patient our partner or their attendant our partner in our care, so the success is the ultimate result. Thank you. Stay with us until the next video.